Hi, I am discussing about splenic artery embolization, and this is the third part of the video. In this video we are discussing about outcomes and complications. So I told you before in the before videos to read about proximal splenic artery embolization, to read about distal splenic artery embolization and post embolization syndrome, how to treat it, types of embolic agents used in splenic artery embolization. Now I am discussing about the outcomes. The first thing in the outcome is splenic salvage. Splenic artery embolization achieves a 90 to 94% splenic salvage rate in trauma, preserving the immune function and avoiding post-splenectomy infections. And second one is hematological improvement. In hypersplenism, we do a partial splenic embolization, which increases platelet and white blood cell counts by reducing splenic sequestration. And the third part is variceal bleed control. Partial splenic embolization reduces portal pressure, decreasing variceal bleed risk for at least a year. And fourth aspect is cost and hospital stay. Splenic artery embolization is a costlier procedure when compared to non-operative management without embolization, but it reduces hospital stay. Because for splenectomy we need a patient to stay in the hospital for 10 to 13 days usually, and it is lesser when compared to the procedure of splenic artery embolization. In splenic artery embolization, the patient has to stay for at least some 5 to 7 days or 9 days, so it is lesser when compared to the splenectomy procedure. So medical students, read about splenic salvage in splenic artery embolization, read about hematological improvement that occurs in partial splenic embolization in hypersplenism, read about how partial splenic embolization controls the variceal bleed, and cost and hospital stay in splenic artery embolization, read about how to counsel a patient for splenic artery embolization prior to splenic artery embolization, how to take a consent for splenic artery embolization, all these. And coming to complications, there are few complications that are moderate to severe, and first one is post-embolization syndrome. It is common, including fever, left upper quadrant pain, nausea and anorexia, managed with analgesics and anti-inflammatory drugs, and managed with patient analgesia. Next one is splenic infarction, higher with the distal embolization procedures, usually asymptomatic but may require monitoring. Splenic abscess, more frequent with combined embolization or near total embolization treated with percutaneous drainage. Infections are common, and risk is reduced with antibiotic prophylaxis, as I have said before. Rebleeding risk is rare, but distal rebleeding after proximal embolization may require complex reintervention, means it may require a redo. Others like pleural effusion, ascites, or portal vein thrombosis, or pancreatitis, though most are self-limited or manageable with anticoagulation or drainage. And mortality, it is rare but reported in severe cases. For example, abdominal compartment syndrome post-embolization may lead to splenectomy and death. So what are the complications? Post-embolization syndrome, splenic infarction, splenic abscess, infections can occur, rebleeding can occur. Others like pleural effusion, ascites, portal vein thrombosis or pancreatitis can occur. There is a risk of mortality. So medical students, what do you read about? What is post-embolization syndrome, and after splenic artery embolization, and how do we manage it? How do we aggressively treat post-embolization syndrome? How to treat post-embolization syndrome in an ICU setting? How to treat splenic infarction that is developed after distal embolization technique. How to treat splenic abscess that is developed after combined embolization. How to treat infections associated with splenic artery embolization. How to treat a rebleed. What are the complex reintervention procedures that can be done after proximal embolization. Read all these. Thank you. Please subscribe.